Dementia describes a collective of degenerative brain diseases that involve a variety of different changes. Many of us are familiar with the cognitive changes, the changes in thinking and memory that accompany dementia, but it also is a spectrum of illnesses that involves a variety of other functional losses. Dementia is an illness for which there is no curative treatment. It is progressive. There are no treatments presently that even manage or halt progression of the disease. Consequently, an approach which is important to consider in providing this care is a palliative approach to service. As a progressive illness, dementia involves a variety of different functional losses. From the time of diagnosis through a person's experience with the disease, there are a variety of other changes which occur.
A person no longer has control of their functions. And so, generally speaking, it's vascular changes and the brain is shrinking.
In its later stages, a person has often lost the ability to mobilize independently, to use the toilet, to manage any of their self-care.
Their movements aren't as coordinated, and they may trip over their own feet or lose their balance.
What we also see in those latter stages of life are some challenges with communication and eventually even swallowing. Those changes are important to recognize because each of those losses can increase a person's risk for a variety of different complications. This might include complications such as falls and injury related to falls.
If a person with dementia experiences a serious illness, typically we might see a serious infection like pneumonia that can be very difficult to recover from, or a fall.
The falls risk is significant. It can be the compounding factors of inability for the brain to process one foot in front of the other. It can be the muscle wasting that goes with it, the strength is diminished.
With subsequent health challenges, the consequence for that person can be much more dramatic. A person often doesn't have a diagnosis of dementia in isolation of other health challenges. It wouldn't be unusual to have concurrent diseases such as heart disease or lung disease or even kidney disease.
A palliative approach can certainly be part of the care plan when we think about addressing pain and symptom management, psychosocial care, spiritual care. It's all part of a holistic approach to caring for that individual.
Palliative care approach should be used when there's a life-limiting illness or a chronic disease where we know that there is no reversibility for that patient or resident.
We can think about a palliative approach focusing on the comfort and quality of life for that person, as well as thinking about treatments that will help provide comfort for them.
Aggressive medical intervention doesn't necessarily improve a person's comfort or quality of life, nor does it necessarily increase their lifespan.
It's important to ask questions to your healthcare provider about what can they expect. So what are my choices moving forward on behalf of my loved one?